No more exclusions. If you are tested, you find out you are HIV positive, go and get your health care because you will have a number of ways to do it. No more exclusions for pre-existing conditions. This should be high on your agenda to talk about. Guaranteed benefits. Now let's talk about it. There will be a healthcare exchange that should be up here someplace. And in that healthcare exchange, here it is, way over here. A health insurance exchange where you can choose the plan that's right for you. Now, if you already have health care and you're insured and you like it, keep it. Nobody is going to talk about taking your health care plan. The opposition of those who say government is taking over everything and it's going to tell you what you can and cannot do. That is not true. If you have a plan that you like, keep it. That's very important for all of you to understand so that when you run into those who say the government is going to tell you what kind of plan you can have, you can tell them not true. You can keep your plan if you like it. But this is how you will be able to compare all of the plans. There will be a healthcare exchange where you can choose the plan that's right for you. If you don't have a plan, if you don't like your plan, we're going to provide all of the information about all of the insurers. This is what they cover. This is what they don't cover. This is what you may benefit from. You will choose if you would like from that exchange. But there's one thing about all of this that you've got to be activists on, and that is this. Every plan, no matter what plan it is, must have guaranteed benefits. Must have. So, AIDS activists, what should you be advocating for? What's in the guaranteed benefit plan? How is it going to come about? There will be a commission that will be organized. Who will be on this commission representing the HIV/AIDS community? Who's going to be the advocate to get someone on the commission to make sure in that plan that routine testing for HIV/AIDS at every doctor, every healthcare clinic will be available to everybody? So, we're talking about prevention. We've got to, number one, be focused on comprehensive healthcare coverage for all. We've got to make sure that we're in the guaranteed benefits. That's a part of what is adopted as guaranteed benefits. I don't know what's going to be in this, but for example, maybe it will be a physical examination at least once a year for everybody in the guaranteed benefits, on and on and on. But you must become real advocates to make sure that HIV and AIDS are represented in the guaranteed benefits. No more exclusions. Keep your plan if you like it. They're scaring the death out of seniors, and they're telling them that we're going to pull the plug on grandma. I assured everybody, we're not pulling any plug on grandma. I am grandma, and I'm not pulling any plug on me. What we find as we look at these benefits is some of our healthcare providers have been getting more money under the Advantage program for seniors, but they have not really been spending it on them. That has not been demonstrated. We have looked at it, and so we're going to make sure that we enhance those benefits and they get the benefit, all the money that goes into health care and Medicare. Support for small businesses. As you know, there was a scare, and they said to small businesses, you can't afford to provide health care coverage for all of those people who work for you. You're a small business. If you have to provide health care for them, you're going to end up having to close your doors. We fixed that. What we basically said is this in the plan that we put out on the House side, in the bill that came out of the Energy and Commerce Committee. We will not consider anyone making $500,000 or less to have to provide health care coverage for all of their employees by themselves. We will subsidize the health care coverage for small businesses, $500,000 or less, so that that small business will not be disadvantaged. Your employee will not be disadvantaged. And don't forget, we have many people working for small businesses who need to have these examinations, who need to have these benefits. They will all be taken care of. Training for healthcare professionals. We anticipate that with this explosion, we have 47 million people who are uninsured, that we have a need for additional healthcare professionals, nurses and doctors, etc. And so we're going to have in the bill additional training and support for those who want to go into the medical field in all different kinds of ways. So we're especially poised to make sure that we expand opportunities for nurses and doctors and healthcare professionals who may be assistants, healthcare assistant physicians, on and on and on, to take care of all of the new people who will be brought into the system. Expansion of community health clinics. This is extremely important. We have these federally supported healthcare clinics all over America. They need more money, they need more support. They're in these communities providing care for the uninsured, for the marginally insured. But this is something that I want to just spend a minute on with you in terms of prevention. I visited all of the federally supported healthcare clinics in my district during the break. And guess what I discovered? People in the waiting room, bored, half asleep, anxious to get served, people just sitting there. Why isn't someone talking to folks who are sitting in these healthcare clinics waiting for service? You talk about prevention. One of the things we're going to have to make sure we do when we talk about prevention is, number one, we've got to have material in every healthcare clinic that talks about HIV, AIDS, and testing, and all of that to educate people. You want to talk about prevention? We need screens up with programs while people are sitting there doing nothing, looking at the information, talking with people who are explaining to them what HIV and AIDS is all about, how to avoid it, and what they should be doing. This is a lost opportunity with people sitting in healthcare clinics with no information. So let's see what we can do about that. Now, you know that healthcare insurance is mandated for everybody. Under the bills that are moving forward, we say everybody must have healthcare insurance. How do you get it? If you're employed and you have an employer who provides it, maybe all of it pays for all of it, or some part of it, you pay for the other part, that's a way to be covered. If you have to purchase it yourself, you can go on the exchange and you can find a healthcare insurer that you like and you can choose your plan. Or if you decide that you're not going to buy it because you don't believe any of this, then when you file your income tax, you're going to be taxed 2.5%. And why is that? Because if you get hit by a car, you're in a car wreck, you're in an accident, you've got to go to somebody's emergency room, you've got to receive some health care. All of the taxpayers who are paying in and buying health care insurance would be paying for you if you don't participate. So we would like everybody to find a way to participate. If you don't have much money and you say, well, listen, I make minimum wage, I don't have a lot of money, I can't afford it. We have subsidies for those who do not have. We have credits to make coverage affordable. We don't want you to pay more than 11% approximately of your income for health care. You would then qualify for credits to make sure that you have the money to afford your comprehensive health care insurance, okay? The big question that's on the agenda has to do with the government option that's up here somewhere. The government option is what is being discussed.
This way, baby.
Here it is, right here. A public option to complete with private plans. There's a lot of discussion about this. Confrontation. And this is where the opposition, the right-wingers, are confronting all of the town hall meetings. They're on the air, they're all over, talking about government is taking over your health care. Not true. I've explained the options. But why is this so important? Healthcare insurance companies have been getting away with murder. They've been ripping